Hi, I'm Dr. Mirrafati. I'm continuing the series of our video about the top 5 regrets patients have post breast implant. These are basically from my patients in the last 30 plus years that I've done 8,000 augmentation. Number 3 in our list is, and I see this all the time, patient come to me for revision and a year later, 5 years later, I wish I would have asked questions about the placement of my implant or the route that you're going, that the implant was done. Oh, I didn't even know you can go from axillary, not even damaging my scar. Oh, I don't know why he put it under the muscle. He just said, I want to put it under the muscle. Or he just said over the muscle. When you come for a consultation in here, I actually sit down. And my consultation takes about 40 minutes. We literally talk about everything. And I actually have a video on breast consultation right here. If you guys want to go watch it, it's about 15, 20 minutes. But bottom line is you have to understand, and in a layman language, remember I often say if the doctor can't explain to you in a layman language what he's trying to get across to you, either mean he doesn't understand it or he's just trying to use a lot of jumbo mumbo medical language for you to be intimidated not to ask questions. So under the muscle, over the muscle should be explained to you in detail. And I often patient comes in and they have an implant in here and I do a lot of Latinas and the breast sort of sagging on top. And I said, well, they're talking about, oh, I am big. I said, well, you're not big. You just have a wrong placement of an implant. He put it under the muscle on a glandular tubular breast. Now your breast is sort of falling on top of that. And what was the purpose of going under? Well, I don't know. He just said go under, and I trusted him. No, ask question. Why are you going under? What's the benefit of going under versus over the muscle? There's always a positive and negative, and remember the positive things always gotta basically outweigh the negative, and that's the placement for you. That's where the implant's supposed to be. And also the route. Are you going to cut me around areola? Are you going to cut me under the breast? Are you going to go for maxillary? Are you going to go for a belly button? All those routes should be explained to you with negativity and positivity of both of those routes. And for you to make that decision, you should be able to together come up with a decision. Well, you know what? The most important thing in my book is I really don't want to feel the implant. And if the implant is going to be a little hard and my breast drop on top of that, I'm okay with that. Then you go under the muscle. But if you come and say, look, I really want it to look really natural and I do have a lot of breast tissue and my breast is a little drop. So if you go under, with that, it's going to exaggerate the drop. Well, of course, because the implants, the muscle's here and the breast is in here. So you're going to have a 4 breasts, one up here, one down here. So it doesn't look good. Now, it's kind of hard for me to explain this in this video, but what I'm saying is that going under or over the muscle and the route for that placement of implant should be discussed to you in detail. Don't go back and say, well, I don't know. He just said, go over here. I did it. Or he said, put this size implant. I did it. No. Ask question. Let them explain to you what is the benefit or disadvantage of going under the muscle or over the muscle. And why would you suggest to me go under the muscle versus over the muscle? All of us, when we start practicing, everybody we did was under the muscle, including me. I fall too. So, but as I've done more and more, I've got to do, I've done over 8,000 augmentation and I've done patients from across the board. And you realize not one antibiotic is going to cover all the infection. One route, one placement is not going to be remedy for everybody. So you need to know, what is my chest size? What is my body type? What is the gland? What is the feel of the breast I'm doing? Now, should I go under or over? More importantly, how strong is that muscle? If you got an athlete coming in and every day they're pumping that iron and their chest muscle is strong, now can you imagine you go under that muscle every day, you're pounding that implant every time you lift, you do push-up or you do chest. So those things need to be explained to you. So make sure you ask all those questions so you don't have this regret when you come to see one of us that we do a lot of revision and now we give you a price that you wouldn't expect to revise and why do I have to do this? Why do I have to pay so much? Why do I have to go back again? So ask a lot of questions and make sure you completely understand. And if you don't understand it, ask again. Ask again until you understand. And if you like what I'm doing with these videos, I really appreciate it if you hit that subscribe button so I can just actually continually do these educational videos for you guys. Stay healthy.